Hi everyone, this is my annotated bibliography presentation on schizophrenia disorder. I chose to do my presentation and my paper on schizophrenia because it is a subject that a lot of Americans have, and it also is a disorder that a lot of people don't know much about. Approximately 2.4 million adult Americans are suffering from schizophrenia disorder of some sort. Um, and this number is not even including children. So a lot of people are suffering in this country from schizophrenia. So what exactly is schizophrenia? Schizophrenia is defined as a psychotic disorder or a group of disorders that are characterized by severely impaired thinking, emotions, and behavior. The disorder it comes from two Greek words that mean split mind, and it was coined in 1908 by a Swiss doctor named Eugene Bleuler. So this disorder has subtypes, and the main five are paranoid, which is a combination of false beliefs, and hearing voices with more nearly normal emotions and cognitive functioning. So the combination of false beliefs, which are the delusions, and the hearing voices, which is the auditory hallucinations. The second one is disorganized, which is where the speech, thinking, and behavior coupled with flat or inappropriate emotional responses to a situation. The third would be catatonic, and this would include disturbances of movement, of agitation, bizarre posturing, and repetitive imitations of the movements or speech of other people. The fourth one is undifferentiated, and this would be where the client would have positive and negative symptoms of schizophrenia but do not meet the specific criteria for either the paranoid, disorganized, or catatonic subtypes. And then the fifth one is residual, and this is where a client would have had to have at least one acute schizophrenic episode but does not presently have strong positive psychotic symptoms such as the delusions and hallucinations. Um, and so to date, there is no known cause of schizophrenia. So it makes it really hard for doctors to actually pinpoint what the cause is of schizophrenia. And then also the treatment depends on which stage the client is in. So if the client is in the acute phase, then they are more likely going to be hospitalized. They are typically giving antipsychotic drugs that will help to alleviate the positive symptoms such as the hallucinations and the hearing of voices. And so this is, good information to have in terms of trying to come up with a program for schizophrenia. In terms of the program that I would want to create based on the literature, when I was doing my research and looking up articles, there were a ton of articles that particularly pertain to misdiagnosis of African Americans and of schizophrenia. And so it it really just, like, I guess, touched my heart because I know someone that has schizophrenia, and I see the life that they live and how the disorder has affected their life. And so when I read all the articles about the misdiagnosis that is high in African Americans, it makes me, curious to know what could have been prevented in terms of misdiagnosis. And so according to Canyon, the dyad of an African American patient and a non-African American clinician leads to the high frequency of misdiagnosis. So I feel like, you know, clinicians, and I feel like it goes back to when we are taught to, be in tune with our own biases and really look at the client holistically, because what the clinician might think is, a symptom of schizophrenia, it really might be just a part of their culture. And so Whaley suggests that African Americans are overrepresented among schizophrenia diagnosis. And so this is just another source that, you know, researches this particular topic. So according to the DSM-5, in terms of schizophrenia and the characteristics of schizophrenia disorder, is characterized by at least 1 month of 2 or more of the following symptoms, which are listed as delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms. And so if a client has 2 or more of these symptoms for at least a month, then they could possibly, be diagnosed with schizophrenia. In addition, the individual must experience deterioration in previous functioning such that the total illness duration is at least 6 months. And so this is important for clinicians to really pay attention to. Schizophrenia affects about 1% of men and women around the world, and men typically display signs of the disorder earlier than women. The onset of schizophrenia is typically in childhood and early adolescence, and if a client is diagnosed as a child or as an adolescent, that is associated with longer term and more negative impacts on that person's life. A person who experienced diagnosis later on have more positive prognosis. Okay, the 4 areas that, if they are enhanced, will cause a higher quality of life and lower need for daily supports in people that have been diagnosed with schizophrenia, are the need of attention in real world functioning and work, independent living and social domains, well-being and satisfaction with life, and ability to engage successfully in treatment and functional capacity in social situations. So if any of these 4 key areas are enhanced, then that will cause a higher quality of life for patients, and it will also lower the need for them to have daily support. Based on the articles that I read and that was in my research, the needs that were assessed for this program would be the African American community and the misdiagnosis of this population for schizophrenia disorder. The program would cater to individuals that have been diagnosed to make sure that they really have schizophrenia, but also it would cater to the ones who have been misdiagnosed and need support after they have been informed that they were misdiagnosed of schizophrenia. So I named my program Schizophrenia Assistance and Support Services, or SAS for short. And this program would be multidimensional, and so it would be for clients who were actually diagnosed with schizophrenia, and so they would go through a 12-week program, and then they would also be educated on how to live a productive life with schizophrenia. They would have support groups, and they would also have access to individual therapy. And then on the other side of the program, it would be for the clients that have been misdiagnosed with schizophrenia, and they will go through a 6-week program. They will, have access to support groups where they can express how the misdiagnosis has changed and affected their lives. And they will also have access to individual therapy as well. Both groups would also be exposed to education regarding what schizophrenia is, the symptoms, how it interrupts their life coping skills, and just how to live with schizophrenia, or if they've been misdiagnosed, how to basically recover from the misdiagnosis. In terms of budgetary suggestions and finances, I feel like about $2 million or more would be needed to get this program running and off the ground. I think schizophrenia is a disorder that a lot of people suffer from, and so I feel that there needs to be resources available to this particular group. I would want to use grants, and I would want to use community input, such as different businesses in the community. I would also want private donors and sponsors, and the money would go towards psychiatrists, psychologists, therapists, counselors, other staff, support, resources, the promotional items, and any other thing that's needed to help fund the program. I would like for this program to be at no cost to clients. That means no billing to insurance, no cost, copay, any of that stuff, because I feel like this particular population has enough to deal with just by having schizophrenia or by being misdiagnosed. That could be very traumatic. So I feel like, they should have some type of support at no cost to them. In terms of the impediments for this program, the number one thing would be no money. Not being able to be funded, no grants or anything like that. And then the second biggest and most important thing would be no willing participants. This program would be completely voluntary, and so I would want participants to come willingly so that they can receive assistance and actually be able to get that assistance and not have to worry about how they are going to pay for it. I also, one thing that could possibly be an impediment is that the clients will be afraid because of social stigma. So what will their family think? What will their community think about them? And then last will be no staff. Anytime there's a new program or something new, people are always kind of skeptical. And so that could be a possible impediment when trying to get this program up and running. In terms of promotional materials, I would definitely want to use TV, social media, brochures, the radio, flyers on cars and handing them out. And then I didn't put this on the slide, but I think the biggest promotional method would be word of mouth, because if someone knows a family member that has schizophrenia, or a loved one or a friend or whoever they know, and then they see this and they say, oh, well, this might be good for so and so and so. They will tell that person, and then that person might tell someone else that they know. And so I think word of mouth would be the biggest promotional material, but definitely all the other things listed. And finally, the evaluations. How are we going to evaluate the program to see if it's working or if it's not working? So I would definitely want to do pre and post assessments to figure out, where they are when they come in and where they are when they leave. But I would also want to do mid assessments, just to kind of gauge where they are in the middle of the session, to see, where we can revamp in the middle of the session so that it can possibly improve the post assessment and the outcome. I would definitely want to do individual feedback, and so I can get feedback on what they thought worked and what they thought did not work in terms of the location and the staff and the structure of the program. At the end of each session, or each time that the client would come for either the 6 weeks or the 12 weeks, I would want to get some type of check-in at the end of whether it is a group session or an individual session, to see what they felt about that particular thing that they did that day, whether it was an activity or group or individual. I would want to check in with them and see where they are. So this is my presentation, and I hope that you have learned something about schizophrenia and the symptoms that is involved with schizophrenia. Thank you.